If you're taking a PPI, you're in very good company with many Americans, but unfortunately the risk of taking this drug, there are many risks. I want to talk about a specific one today, and that is what happens to your bone mineral density when you're on a PPI. Because when you reduce stomach acid, you reduce calcium absorption and magnesium absorption. And when you're reducing your absorption of these minerals, then you're putting yourself at greater risk of osteoporosis or brittle bones. Now, for women especially, what happens when we reach menopause is our hormone estrogen goes down even earlier, which I'll get to in a minute. But what I want to talk about is the seriousness of osteoporosis. It's not just, oh, I'm losing some bone density, you know, whatever. But it's quite serious. So the risk of mortality once you've had a hip fracture is anywhere from 14 to 58%. So obviously that's a huge, you know, differential between those numbers. But obviously it depends on age and other factors. So it's the other factors that I want to talk about as well. And within the first 3 months for women, if you compare, let's say a woman has a hip fracture at age 65, and you compare her against a woman who's also 65 and you know, their other health factors are the same. A woman with having the hip fracture is 5 times more likely to die than the woman who's exactly her same age and other factors are the same. So it's a 5x increase in mortality. So having osteoporosis, having a hip fracture is really, really serious. So what do we need to do to avoid this? Now, if you're on a PPI, as you know, this channel, we talk a lot about Hiatal Hernia Syndrome, and you're on a PPI because you have acid reflux and that makes you miserable, and the PPI lessens those symptoms, so it seems to be your friend. It's not really. So it in addition to osteoporosis and getting increased infections and getting dementia and about 7 other risk factors, PPIs are not innocuous, and so what we really want to do is figure out what is the irritation to your stomach that's creating this acid reflux and handle that. So you handle it at its root cause, and then you don't need the PPI anymore. So that we can do, that we do all the time, and so that's a risk factor we can get off the table fairly easily. But I want to talk about other risk factors like having low vitamin D level, because that's almost epidemic in this country that people don't have adequate vitamin D. So get your vitamin D checked. Now, what do we do about age? You can't do anything about the chronology of it, but you can do a lot about the factors associated with it. So as women, our predominant sex hormone is estrogen, and estrogen builds bone density. It helps retain strong bones. What else does it do? Yeah, it slows bone loss and it increases bone density, which is exactly what you want to do. Because as women, we hit the age of 30 and then we start losing more bone than we're making. So this begins quite early in life. So if you're in your teens, 20s, 30s, all the way up through 80, this message is important, because the good news is it's never too late to balance estrogen, and it's never too late to do another thing I want to talk to you about, which is resistance training, lifting weights, because that stimulates your body to build bone, regardless of your age. Are you going to build a lot more bone density at age 30 than you are at age 60? Yes, but it's not fruitless. You will build bone density, you will get stronger muscles, you'll be more agile. So if you trip on something, trip on the edge of a carpet, you're not going to go falling, you're going to catch yourself because you're agile, and that's why we need to work out. So it's to increase bone density, but it's also to get stronger muscles and be more agile. And that comes with this type of exercise. The other thing I wanted to talk about, harkening back to hormones, is that there are things that young women can do that are really problematic. So one of them is a form of birth control that is a progestin only, or progesterone. Progesterone is the natural hormone, progestin is the synthetic. So the Depo-Provera shots particularly are something that young women can love because they have no period. Well, if you have no period, you've turned off your estrogen production, and now at the age that you should really be building and getting robust bone density to sort of take you through, instead you're turning it off and really increasing your risk. So if you're a woman who's been on Depo-Provera, I'd find an alternative quickly. Also, if you're a woman in your early 40s, now is the time to actually have a functional medicine type clinician check your hormones, because we check for them much more sensitively than your classic GYN would do, because they have a very broad range of normal. They're not looking for the specificity that we are to say, no, this is non-optimal and we need to do something to increase this estrogen. Doesn't necessarily mean you go on hormones, but there's other things that can boost estrogen, and this is very important. So we want optimal vitamin D, we want optimal estrogen, and certainly once you are through menopause or premenopausal, and when that estrogen is really starting to plummet, you lose a lot of bone density during those years. So if you can jump on the wagon of assessing your estrogen and maintaining it at a good physiologic level, you can really fortunately miss that window when estrogen just plummets around menopause, okay? So we want to keep the estrogen normalized. We've got to exercise. You've got to do resistance training. You've got to fight against gravity. You've got to lift weights. Yes, do it on a gradient. Yes, find a trainer who knows what he or she is doing. So if you're an older woman and you're approaching premenopause, menopause, or beyond, remember, it's not too late, but you really need a trainer who knows what they're doing. I have one who's a gem, even though she's only in her 20s, and I could call her a baby, but I won't. She's brilliant at assessing what I can do and what is too much for me, and that's what you need, because I've had an earlier trainer who was just more robotic about, well, you're a girl, this is what we do, you know, and that's not what you need. You need that intelligence. Now, there's a lot of women on YouTube and doctors who know a lot about this. There's a lot of books out there. My only problem with that, and it's a great way to start, and it's a great way to get educated, but form is very, very critical. So somebody watching you and saying, no, you know, you want chest up, you want knees bent, you know, you want your butt out, you want your, you know, but looking at your form so you're really building the right muscle versus straining your low back, which I did recently. So form is very critical, and that's my only caution about that. But if you haven't been doing anything, then anything is great, and just get moving, do some resistance, and sure, you'll start out with baby weights, that's totally fine, you'll build up, but making that a priority is really, really key. So what else did I want to talk to you about? Oh, there are certain drugs that increase your risk of bone loss. Antidepressants is one, PPIs, as I mentioned, and birth control I mentioned. Also, if you happen to be hyperthyroid and it's not being treated appropriately, you can lose bone density. So you definitely want to check with your doctor. Am I on any medications that are associated with osteoporosis? And then we can help you get to the root cause of that problem and see if we can't, you know, wean you down and or off those medications. Okay. Oh, smoking and excess alcohol, really any alcohol, to be honest. We're, you know, realizing how much of a toxin it is. But if you smoke or vape and you drink alcohol, that's increasing your bone loss as well. Eating enough calcium, so that's in dairy products, as long as you tolerate dairy, or lactose-free dairy if you have a lactose intolerance, salmon, sardines, soy, just make sure the soy is organic, so there's no GMO. And so these are the things to do, but again, if you're on that PPI, is decreasing your calcium absorption. So you're kind of defeating the purpose there of eating the food if you can't absorb the calcium because you have no stomach acid. Okay, so I think that's everything that I wanted to go over. And yeah, and as I said, regardless of your age, if you're a mom with teens, or you're a woman who has a daughter in her 20s or 30s, really have her listen to this so she realizes the importance of like putting that bone density in the bank while she's still young and able to boost, really boost it. If you know young women on Depo-Provera, or any women on Depo-Provera, realize that loss of estrogen is really going to hit them hard. And again, we need to exercise. And so if you need help with any of this, and normalizing your estrogen. So any of these things is what we do here at Root Cause. We can help you out. I'd love to do so. And we'll talk soon.